In Ukraine, currently we have the emergency medicine reform, and Ternopil National Medical University is one of the leading universities in Ukraine for providing medical education at the level of the first medical education and also as a postgraduate training. This simulation center with its ambulance, with this emergency department that you've seen, this is extremely unique. This is the only simulation center in Ukraine that has such many capabilities for such a big and deep training in emergency medicine. That's why our university is one of the universities who is providing different levels of education in terms of emergency medicine. Workers of our universities are the leading experts at the Ministry of Healthcare of Ukraine. They are the ones who are writing different educational programs in emergency medicine, in intensive care and in other subjects. Students, thank you for successful completion of your scenario. Your work was very good. You worked as a team. Everything was going very good. But right now I would like to discuss with you the basic principles. What was the goal of the examination of this specific patient? So at any case, at any scenario, at any patient, we need to remember about the ABCDE approach. So what does this approach include? A, it's always about the airways. This is about the potency of the airways and the ventilation with the oxygen, which can be delivered through the different ways, through the placement of the oxygen mask, through the ventilation, through the embu bag, through different more advanced methods like endotracheal intubation, nasopharyngeal or oropharyngeal airways. B, it's always about the evaluation of the breathing function, about the evaluation of respiratory system. So what is included into this examination? So we always check for the respiratory rate, for the excursion of the chest, for the SpO2 or pulse oximetry. We always check for the neck, if cervical veins are not distended, if we don't see any tracheal deviation. We also do the three main things about the examination of the chest. This is the percussion, palpation and auscultation. If we don't see any critical situation in terms of pneumothorax or other bleedings. C, it's always about the circulation. At this point we will evaluate always this circulation in the body of our patient. It's always about the check of the pulse. It's always about the perfusion, the capillary refill time, about the blood pressure. It's always about the cardiac monitoring to see if we have any rhythm changes, if we see any cardiac rhythm abnormalities. We always provide the IV access in order to provide the good infusion of the bolus, and also this access can be provided through different routes based on the situation. It can be either IV line or IO. D, it's always about the neurological examination. We check for the pupils, we check for the level of consciousness according to the AVPU or Glasgow Coma Scale, and we also check for the reflexes if we see any neurological abnormalities. And E, it's everything else. We always check for the extremities if we don't have any wounds, any minor bleedings. We check for the skin, and of course we end up with the checkup of the spine if there are any injuries or traumas. There are multiple opportunities for medical students who are from Ukraine and from abroad to experience the best of medical education in Ukraine. There are multiple students' organizations in our university, like EMSA. There are multiple opportunities to experience different European certified courses because our university is having the basic life support and advanced life support instructors who are certified via European Resuscitation Council, which is the leading organization which provides the guidelines which are delivered throughout the whole Europe about the CPR, about the critical conditions. The academic staff of our university is also working on a lot of the national books in different subjects, in different areas of clinical medicine. Most of them are also huge experts at the national level in providing different guidelines and consensus statements. When I was a student of Ternopil National Medical University, I had multiple opportunities to experience. My pathway started from doing some small scientific projects at different departments. I was presenting in different conferences in TNMU and in other universities and as well abroad, because there are multiple opportunities for everyone who is very interested in it. There are multiple courses from the European Resuscitation Council that can be delivered to you in terms of the university, during the university studies and in your out classes. Also, there are multiple exchange programs. In our university, the Erasmus exchange program is actively functioning. Students from different courses can experience their studies in prominent European universities as an academic exchange program for one semester. There are multiple agreements signed in between different universities that also give multiple opportunities for students to have their practices abroad, to experience exchange programs, to go for conferences and different summer schools, which will be also very beneficial for you during your 6 years of medical studying, because every single step that you make towards pursuing your medical career will make you a better professional. It's always a good point to put in your CV. It's always the thing that can make you even more competent in your country and will improve for you to make your dream come true, to become a successful and good doctor.